EOC public briefing for today. Today is May 18th, 2021. I want to remind everybody that this meeting is recorded and it will be published on the STIC website at a later date and time. So thank you guys for attending. We'll go ahead and get started with Dr. Cope's report. Thank you.
Great. Good morning, everyone. Thank you, Chief Bruner. I'm just going to get my slides pulled up here. Okay. All right. So welcome. I'm always happy to report that we have no active cases here in Neah Bay. We've had 13 cases total throughout this pandemic. 3 most recently earlier this spring. Those are fortunately all recovered. We have 0 individuals in official quarantine at this time. Clallam County, although they did have a recent relative spike, it does appear that things may be calming down a little bit. However, it's still considered high risk. So they still have a percent positive that is 3.2%. Anything above 2 is considered high risk. They've got 43 active cases. Unfortunately, they've had 1 new fatality, bringing them up to 10 total. They did have 4 hospitalizations earlier this week, even up to yesterday. So it looks like 2 people have recovered from the hospital. So that is really good news. So this data is through May 16th and shows you that what I spoke of as a relative spike here. So last week they were closer to the 110, and now data through May 16th showed that the rate of cases per 100,000 had gone up a little bit. It looks like from these dashes here, it's expected to go down, but again, we'll just have to wait and see. Clallam County is expected to have these kinds of spikes up and down here as long as their vaccine rates don't go up. And they have hit kind of the similar wall that a lot of places have hit where people are reluctant to get the vaccine. Washington State is showing a pretty steady decline in the rate of new cases per 100,000. And then actually the rate of new variant cases has actually slowed down a little bit. So whereas, especially with this B117, things were doubling nearly every week, it's actually not doubled in the last week. So that is encouraging. We have more than doubled though in Clallam County. So we went from having 2 cases to 5. Again, we anticipated that there were way more than 2 cases because the rate of testing or the genomic sequencing for the variants is so low. So I'm not really surprised by that number. I think we've known we've got actually probably more than 5 cases of that variant, the B117, especially associated with the earlier outbreaks this spring. We do have 1 case of the B1429 variant now in Clallam County, and that's the one out of California that has been in Washington for quite some time. And then none of these cases or these variants have been detected in Clallam County yet. And these are variants of interest, so they haven't quite risen to the level of various variants of concern. And my apologies, that data is from May 12th. We have all 3 vaccines available at STIC. The Moderna clinic is going to continue here at the clinic, and that's vaccine that's available for all persons 18 and up, continuing on Fridays. We have Pfizer, which is authorized for anyone 12 and up, and we are offering that on Thursdays, and that's at the community gym at this time. And then we have Johnson & Johnson, and that is just offered as requested. That is the single dose vaccine, and it is authorized for ages 18 and up. I've been tracking all the real-time data that we have now, and an update that Pfizer and Moderna vaccine is 94% effective with 2 doses for at least 6 months against any severe, critical, or fatal COVID infection. And then 82% if the individual only had 1 dose. And I do want to acknowledge the CDC recommendations that came out last week. So specifically, the CDC updated that fully vaccinated individuals no longer need to wear a mask or physically distance in any setting. except where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including local business and workplace guidance. So very specifically, the CDC just gave kind of the authority over to these jurisdictions to make their rules based on what they know is working best for their business or community or organization, and certainly for our tribe. And I just want to acknowledge that the Makah public health protocols have always exceeded some of the CDC guidelines, knowing that our goal is to prevent one death, and that's what we're charged with by the Makah Tribal Council. And so certainly I know the council is considering any certain changes, but I want to remind the community that the Makah Tribal Council's Health Order 0321 is still in effect, which has us in phase 3 of the Makah COVID-19 public health protocols. I don't have the protocols pulled up on these slides, but I do want to say that fully vaccinated individuals are authorized under those protocols to engage in social gatherings without wearing masks or social distancing, as long as all of the adults involved are fully vaccinated and there are no kids present who are at high risk for severe illness. And that's because the kids are generally unvaccinated. Now that kids 12 and up can get vaccinated, that certainly will change things as well. And that's it, unless anyone has any questions.
All right, thank you, Dr. Cope. Appreciate the update. And I don't see any questions in the queue as for right now. So no updates for the Makah Tribe organization at this time. As far as the EOC, we're still working with the Cape Flattery School District on the graduation plan. We're also moving forward and offering suggestions for the 4th of July plans to Makah Tribal Council for approval. There was a small change on the stick.org website. All the graphs, we are experiencing some technical issues. So those were pulled down. They'll be put back up at a later date once that issue is resolved. I want to remind everybody, May 25th at the Village Market will be the mask and hand sanitizer distribution for this month. And please practice social distancing, wear your mask when out in public and traveling. Other than that, I want to extend my appreciation to everybody for attending and also doing everything you can to prevent the spread of this outbreak. I want to thank the Makah EOC stick staff and the Makah EOC staff. Thank you to the community for all your efforts. Keep it up. And thank you to the Makah Tribal Council.
Hey, Chief.
Yes, sir.
Yeah, we're going to do it on the 26th, not 25th.
Okay. Thanks for the update. So just a reminder, May 25th be the 26th will be the public distribution. So thank you guys, and we'll get those publications posted throughout the community, and have a great day.
Thank you.